morning. My name is Dr. Eric Toshlag. I am the Chief of the Division of Trauma and Acute Care Surgery here at the Brody School of Medicine at East Carolina University. I also serve as Trauma Medical Director for Vidant Medical Center, our 1,000-bed quaternary teaching academic medical center, and I've had the distinct pleasure to be the Fellowship Director, Program Director for the Surgical Critical Care and Acute Care Surgery Fellowships for the past 15 years. First and foremost, I hope this correspondence today finds you well and safe during these very trying times. A bit of history. When I finished my fellowship at Vanderbilt University Medical Center in the spring of 2000, I had the distinct pleasure to be recruited by Dr. Michael Rotundo. Dr. Rotundo had just left the University of Pennsylvania to become the Trauma Medical Director and Division Chief here at East Carolina University. So in the past 20 years here at ECU, I've watched this medical center grow, and I've watched us begin a training program that I believe is of incredibly high quality and of which I am incredibly proud at this time. We were fortunate to become accredited by the ACGME in 2004, and in the past 15 years, I've witnessed what is an amazing evolution in the scope and quality of this program. We became the 9th Acute Care Surgery Fellowship accredited by the American Association for the Surgery of Trauma in 2010. We have subsequently grown to 2 first-year fellows in the surgical critical care year and 2 fellows correspondingly in the second or acute care surgery year. We really feel like the fit and the feel of a 4-fellow program is optimal with respect to mentorship, faculty to fellow ratios, and the service to education ratio upon which we are focused each day. Vidant Medical Center, which is the tertiary care teaching affiliate of East Carolina University, actually the Brody School of Medicine and Vidant Medical Center are physically adjoined, but Vidant Medical Center is one of the busiest tertiary care academic centers in the United States. We serve the entirety of Eastern North Carolina from the Virginia-North Carolina border to the Outer Banks to the South Carolina-North Carolina border. Our eastern catchment area extends to Raleigh and to the Triangle. We see about 3,800 trauma patients here a year, although we're growing at 6 to 10% a year, which is quite remarkable. And what is fortuitous for training purposes is that our penetrating trauma rate here is 15%. We do see a number of stab wounds here, but by and large, the largest percentage of our penetrating trauma are gunshot wounds. We have a busy 24-bed surgical and trauma intensive care unit in which the majority of the training in the surgical critical care year occurs. We also have an EGS service that is really indescribable until you see it in terms of its volume and acuity. It is one of the favorite experiences and the best training opportunities for the second-year fellows. I think what distinguishes ECU is the truly excellent quality within both the first and the second year of the program. I would challenge someone to find a surgical critical care year that better prepares individuals for a life as a surgical intensivist, and also challenge anyone to find a second year that's richer in operative experience, autonomy, and growing in that role as a junior faculty member in terms of professionalism, teaching, your clinical prowess, and of course research.
I think a lot of this fellowship, while within the confines of what the AAST wants the fellowship to be, it's fellow driven. If there are rotations that just don't suit your needs and you're not getting what you want from it, we'll change it. And I think that is also very key, that you have an active voice and the leadership listens and will change it for you.
So for the fellowship and someone who wants to learn how to manage critically ill patients, severely injured trauma patients, critically ill general surgery patients, you're going to have the opportunity to see all of that here. We're fortunate because we're the quote-unquote the kind of only game in town, at least east of 95, given the fact that our catchment area is 29 counties of eastern North Carolina, And for fellows, again, who want to learn all the aspects of being an acute care surgeon, I think the patient population certainly provides them the opportunity to do that. I would say that our fellows have graduated autonomy, and that autonomy is really based upon their confidence and their abilities. And so once we are sure they have a great handle on what they need to do, then we can step back and allow them to train and practice as autonomously as it is safe. The last thing that I would say is I just have always appreciated the camaraderie that we have here. For whatever reason, we just seem to attract not just talented, not just intelligent individuals, but people who are just good human beings.
Another unique feature of our program is our emphasis on wellness. It's a bit of a cliche now, but we have recognized burnout within our faculty and our fellows, and more importantly, burnout throughout the United States in our profession. So having planned for this for a full year, I was able to get a wellness intervention and education package funded through which both the faculty and the fellow proceeded last July. I think this has had a tremendous impact on our training program. We have incorporated elements of wellness into the curriculum, and a clear and significant focus of the training going forward will be making sure that we graduate individuals who understand how to be successful in this life with longevity and wellness. I'm really proud to say that this is the distinguishing feature of this fellowship are the people within the program. That includes both the faculty and the fellows. During the interview process, I was struck by a few attributes of Eastern North Carolina and Vidant Medical Center that ultimately drew me to this institution. This was a true diamond in the rough, a large 1,000-bed tertiary care center with outstanding facilities and resources, but people who demonstrated a mission to the service of Eastern North Carolina that I found both sincere and impressive. It was also intuitive that I would want to come serve under Dr. Rotundo and receive outstanding mentorship that ultimately proved to be true throughout the years.
I saw a lot of the same attendings in medical school and residency and fellowship. They worked well together. They were like family. And I think it says something to see faculty stay at an institution for that length of time. I think that overall this group here is a joy to work with. We have complex cases. We have a good trauma system. And so joining this actually was one of the happiest days of my life, just because I got to join this amazing group and remain in Eastern North Carolina.
All the reasons that I came here in the first place, at least back then, a young group of energetic trauma surgeons, not being happy necessarily with the standard of care, always trying to push the envelope, making sure that the way that we are practicing the care of our patients remains novel. Those same aspirations, I think, continue to this day.
So what are we looking for in a fellow candidate? Again, we're looking for character attributes that I see within my partners. High energy, affable. The uniform facial expression is that of a smile. People who are service oriented. Service is a critical element of our mission here. Eastern North Carolina is an underserved region, and we are looking for individuals who want to come, roll up their sleeves, and engage in the hard work of saving the lives of a population that is underserved and vulnerable. It is a core mission to the faculty. It is an expected element of fellow candidates. We want professionalism and equipoise, and we are looking for people who, stated quite simply, love to come to work every day. Acute care surgery is not a job for us, it is a vocation. There is a big difference. And that is a distinguishing feature of my partners and the teaching faculty here, and certainly what we're looking for in a fellow candidate. The curriculum is rich. It includes variable rotations within the first and second years. I will briefly point out that the second year has become more experiential here. I serve on the Acute Care Surgery Subcommittee for the AAST as well as the Program Director Subcommittee, and we have worked hard to do away with specific rotations and move towards an experiential curriculum where the goal is to simply make sure that you get adequate operative training and are ready to go when you leave the fellowship. And that's a defining characteristic of the second year of the fellowship. We also offer a number of international opportunities. We have a trauma rotation in South Africa during the second year, which is optional, but a few fellows have completed it and had very, very immersive experiences in operative trauma. Many in our division are dedicated to international health and service. Our fellows have accompanied faculty to Central America for week-long surgical mission trips. I teach fundamental critical care support course of SECM around the globe. We've taken fellows to Rwanda to teach FCCS, but I think there's a rich opportunity for sort of international health and some unique rotations within the second year. So we would ask you to strongly consider ECU for these strengths that I have defined. What will make you want to come to East Carolina University is clearly the training, the strength of the training. But again, I believe it's this concept of family and collegiality within the division. And it's interesting, I've asked our graduating second year fellows, both at the time of graduation and years later when we cross paths, and often we remain great friends, what was the most challenging part of your training at ECU? Interestingly, many have said the most difficult period during the training program was the time that they left. It's such an excellent 2 years. You get integrated into this family, and it's difficult to move on, but move on people do. And they go out into great jobs and do well within the world. So I pledge to you that you'll leave ECU extremely well trained and prepared for all components of academic acute care surgery. But I can say with utmost sincerity, regardless of what path you choose, my wish is that you demonstrate the elements that comprise the core mission of the program: character, teaching, wellness, and service. We look greatly forward to meeting you, and I hope that this video and the other elements that we're sending you via email prior to your virtual interviews are helpful.